Hello and welcome, new parents. Congratulations on your beautiful new arrival. Bringing a baby home is one of the most incredible experiences, but it can also feel a little overwhelming. Where do you even start? Don't worry, we've got you covered. In this video, we're going to walk you through the absolute essentials of newborn care. Step by step. By the end, you'll feel more confident and prepared for this amazing journey. So take a deep breath and let's dive in. First up, let's talk about feeding. Whether you choose breast milk or formula, feeding is a huge part of your day and a wonderful time for bonding. Newborns have tiny stomachs, about the size of a cherry on day 1, so they need to eat frequently, typically every 2 to 3 hours. That's about 8 to 12 times in a 24-hour period. Look for hunger cues like rooting, which is when your baby turns their head and opens their mouth, putting their hands to their mouth, or making sucking motions. Crying is actually a late sign of hunger, so try to catch those earlier cues to keep things calm. If you're breastfeeding, make sure you and your baby are both comfortable. Use pillows for support. A good latch is key. Your baby's mouth should be wide open, covering not just the nipple but a good portion of the areola. You shouldn't feel sharp pain. If you do, gently break the seal with your finger and try again. A lactation consultant can be an incredible resource if you're struggling. For formula feeding, always follow the instructions on the container precisely. Use sterilized bottles and nipples, and never microwave a bottle as it can create dangerous hot spots. A bottle warmer or a bowl of warm water works great. Remember to hold your baby in a semi-upright position during feedings to prevent ear infections and reduce air swallowing. After every feeding comes burping. Trapped air can make your baby fussy and uncomfortable. There are a few classic positions you can try. One is over your shoulder, gently patting or rubbing their back. Another is sitting them on your lap, supporting their chin and chest with one hand while patting their back with the other. A third option is to lay them face down across your lap, supporting their head so it's higher than their chest, and gently rubbing their back. You might get a big burp, a little one, or sometimes none at all. Just give it a good try for a few minutes after each feed, and always have a burp cloth handy, because spit up happens. It's totally normal. All right, let's move on to the other end. Diapering. You will become a diaper-changing expert in no time. I promise. You'll be changing about 10 to 12 diapers a day initially. Before you start, get everything you need within arm's reach. A clean diaper, wipes, and diaper cream. If you use it, never leave your baby unattended on a changing table, not even for a second. Lay your baby down, unfasten the dirty diaper, and use the front of the diaper to wipe away any initial mess. For girls, always wipe from front to back to prevent infections. For boys, be prepared for a surprise shower and gently clean around the area. Use a fresh wipe for a final clean. Let their skin air dry for a moment. Apply cream if needed, and then secure the new diaper. Make sure it's snug but not too tight. You should be able to fit 2 fingers between the diaper and your baby's belly. Now, what about that little stump of the umbilical cord? It will usually fall off on its own within 1 to 3 weeks. The key is to keep it clean and dry. Fold the top of the diaper down, away from the stump, to let it air out. Avoid tub baths until it has fallen off, Just stick to sponge baths. If you notice any redness, swelling, or foul-smelling discharge around the cord, be sure to call your pediatrician, as these could be signs of infection. Speaking of bathing, let's talk about how to give your newborn a bath. Until that umbilical cord falls off and 4 circumcised boys, until the area has healed, a sponge bath is the way to go. You only need to bathe your newborn 2 or 3 times a week. More than that can dry out their sensitive skin. Find a warm, draft-free room. Lay your baby on a soft towel. Have a basin of warm water, not hot, and a soft washcloth ready. Use plain water or a very mild, baby-specific soap. Gently wash their face with just water, then move on to the rest of their body, paying special attention to neck folds, underarms, and the diaper area. Save their hair for less, so they don't get too cold. Wrap them in a hooded towel immediately after, and cuddle them dry. Once your baby is ready for a real bath in a baby tub, the process is similar. Fill the tub with only 2 to 3 inches of warm water. Always test the water with your wrist or elbow to make sure it's a comfortable temperature. Support your baby's head and neck with one hand at all times while you gently wash them with the other. Make bath time a calm, soothing experience. And again, never, ever leave your baby alone in the water. Next, a topic that's on every new parent's mind: sleep. Newborns sleep a lot, but in short bursts. They can sleep up to 16 to 18 hours a day, but usually only for a few hours at a time, day and night. This is because they need to wake up frequently to eat. To help your baby establish a day-night cycle, keep things bright and active during the day. At night, keep the lights dim, the noise low, and interactions calm and brief. The most important thing about sleep is safety. The American Academy of Pediatrics recommends the ABCs of safe sleep: alone, on their back, in a crib. Alone means no pillows, no blankets, no bumpers, and no stuffed animals in the crib. A firm mattress with a fitted sheet is all they need. You can use a sleep sack or a wearable blanket to keep them warm. On their back means you should always place your baby on their back to sleep for every sleep, naps, and nighttime. This significantly reduces the risk of SIDS, and in a crib means a bassinet or play yard that meets current safety standards. Room sharing, where the baby sleeps in your room but on a separate sleep surface, is recommended for at least the first 6 months. Let's touch on comforting your fussy baby. It's normal for babies to cry. It's their main way of communicating. First, run through a mental checklist. Are they hungry? Do they need a diaper change? Are they too hot or too cold? Are they tired? If all their basic needs are met, they might just need some comfort. Many babies are soothed by swaddling, which mimics the snug feeling of the womb. Learn how to do a secure swaddle, making sure it's snug but not too tight around the hips, allowing for healthy hip development. Gentle motion like rocking or swaying can also be very effective. White noise, like from a sound machine or even a fan, can be calming. Sucking is a natural reflex, so offering a pacifier can also help soothe a fussy baby. Finally, a quick word on your own well-being. Caring for a newborn is a 24/7 job. It's demanding, and it's okay to feel tired, emotional, and overwhelmed. This is a huge life change. Prioritize your own rest whenever you can. Sleep when the baby sleeps, even if it's just for a 2 minute. Accept help from friends and family who offer to bring a meal. Watch the baby while you shower or run an errand. Don't try to be a superhero. Your health is just as important as your baby's. And if you're feeling persistently sad, anxious, or unable to cope, please reach out to your doctor or a mental health professional. Postpartum mood disorders are real and treatable. You are not alone. Taking care of a newborn is a learning process. You will get to know your baby's cues and what works for them. Trust your instincts, be patient with yourself, and enjoy these precious, fleeting moments. You're doing a fantastic job. Thank you so much for watching. We hope this guide helps you feel more prepared and confident. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more tips for new parents. Leave a comment below with any questions you have. We'll see you in the next video.